Hi, my name is Dr. Ross Hauser. I'm a physical medicine and rehabilitation specialist. Welcome to my office in Oak Park, Illinois. We have a volunteer here, a young athlete, with a lot of neck problems. So I'm just going to go over the most common neck problems that people have, not just athletes. And it's actually pretty easy for a person to figure out what's causing their pain and what to do about it. So we make these videos. I mean, these videos aren't just made so, we get more clients. I mean, it's really to help people. Because, there's so many people with chronic pain. I'll give you an example. If you look in the literature, up to 50% of people who have one whiplash injury end up with chronic symptoms. That's just, so imagine like every day all the whiplash injuries that are occurring, not just with cars, but people play football, they play soccer. How many times every year I hit my head? Not that I'm a doofus or whatever, but I do hit my head quite a bit. But all those things are little whiplash injuries, or the little kid falls from the monkey bars, I mean, it's, and think about how many hours a day your head's bent over. Like you're texting or you're doing computer work, and then you end up with chronic neck pain. So I personally think, neck problems are just going to be astronomical because human beings, think about the whole computer thing. I mean, it's all new. Like the computer thing's all new, where most people's jobs is like, even my job, a lot of it's like doing charts and you're all bent over. So what exactly, happens? So the most common thing that people have that have a neck issue, they just know that the muscles are tight, and if you poke on different spots, it's sore, and if they get massages, it helps a little bit. Maybe they'll get manipulation and it helps somewhat, but it's not resolving it. So from a simplistic standpoint, what we do in the office is, obviously I do the same thing, I just, like the person's actually tender right there. So in other words, you yourself can poke on it, and if you see something that's prominent, like in other words, it's prominent right here, and the person's twitching a little bit here, I could really get her to twitch if I wanted to. But, in other words, we just call that a tender point or trigger point. Now, most likely, she has cervical instability right here. Cervical instability means that the vertebrae are moving too much. Generally, the instability is one of two types. The one type is rotational instability, and the other kind of instability that we see a lot of is extension instability. Like in other words, usually people feel better when they do what? They bend their head forward. So if you feel better when you bend your head forward, but it feels worse when you turn your head, or you turn your head back, that's a sign that you probably have cervical instability. The other thing to think about is, does your neck click, grind, or pop? It's not normal. You turn your head or you twist your head and it's like, oh, I could feel something click, grind, or pop. If you have symptoms, especially muscle tightness, and you have clicking, popping, grinding, I'm just telling you, you got instability. You got cervical instability. Cervical instability is causing your problem. Where the instability is, this is kind of the key point, is where the vertebrae meet. The connection between the vertebrae is called the facet joints. They're also called the Z joints. The Z joints or facet joints are where the vertebrae connect one on top of the other. So you can understand if you bash your head, and they've done studies on this, when you bash your head or you have a really quick turning of the head, then that shears the capsular ligaments. The capsular ligaments are what connect the facet joints together. So the actual instability is in the facet joints. That's why traditional doctors do what? Like when they do shots under X-ray, they do facet blocks. They inject corticosteroid or steroid into the facet joints. Or they do radiofrequency ablation of nerves, the nerves that go to the facet joints. So they're blocking the pain response with steroid, or they're destroying the nerve to the facet joints. Why? Because the pain is emulating from the facet joints. That's what it means. But blocking the pain or destroying the nerve, does that help the health of the facet joints? Does that repair the instability? No. It makes a lot more sense to do prolotherapy to stabilize the motion. It stabilizes the motion, so that way when this young athlete turns her head, it's not going to be excessive motion. The vertebrae, because the connection's supposed to be good, when you turn your head, the vertebrae are supposed to stay together. You're not supposed to have the facet joint, go like this, like if they were extending, or it's not supposed to go like this. And if you go on our websites, we got wonderful videos, 3D models that show this. Like there's three-dimensional CT scans where you can have somebody rotate their head. And then you'll see the facet joint. We have one where 70% of the facet joints weren't connected anymore. And that particular patient, so if you have, that particular patient had upper cervical, this is the upper cervical, there's 7 cervical vertebrae. If you go on the back of your head on the midline, if you go on the midline, you'll feel a bony prominence. That's the second cervical vertebrae. So the second cervical vertebrae, the most common cause of vertigo, think of this, vertigo, Meniere's disease, dizziness, ringing in the ears, is upper cervical instability. And the most common symptom that people have is they have a suboccipital headache. This is the occipital bone. So if you have tenderness or you want somebody to push on this area, if you want somebody to push on this area and it actually feels better, or you want to get a massage up there, in other words, these small muscles are going into spasm. You have upper cervical instability until proven otherwise. The upper cervical joints, the C0, C1, and C1, C2, the first cervical vertebrae is called the atlas, and the second one's called the axis. So that joint, the C1, C2, is called the atlantoaxial joint. Those joints are just held together by ligaments. See, there's not a disc between the occiput and C1 and C1 and C2. There's no disc. The discs start from C2 on down. Those discs do add a lot of stability. The reason why God made the body not to have a disc there was you have to be able to turn your head. The turning of the head, over half of the turning of the head comes from C1, C2. So the most common problem that we see in the neck is upper cervical instability. In other words, there's excessive motion of C1, C2. That's called atlantoaxial instability. And on physical exam, the person has a lot of pain up here. Then usually their symptoms are worse with rotation. They commonly have dizziness, ringing in the ears, kind of memory problems, fogginess, weakness, facial pain, stuffiness of the nose, maybe even blurry vision. Some of the diagnoses that people have been given for this are, so if you have any of these diagnoses, Borreliu syndrome, post-concussion syndrome, whiplash-associated syndrome or dysfunction, whiplash-associated dysfunction. So if you had post-whiplash problems, post-concussion problems, or you have this condition called Borreliu syndrome, most likely you have neck instability. And what you need is prolotherapy to the neck, to the facet joint specifically, that they'll cause a tightening of the capsular ligaments. That way when you rotate your head, there's not going to be excessive motion, so nerves aren't going to get pinched, and the vertebral artery isn't going to get pinched. See, the vertebral artery is in the vertebrae. It's actually in the vertebrae, and when the vertebrae rotate too much, that vertebral artery, which basically supplies like a third of the brain, it's like the blood supply is temporarily cut off. So you can obviously see where that could cause spinning in your head or in the room. It could cause dizziness. It could cause ringing in the ears. So if somebody's had, the doctor said you have cervicogenic headaches, it means the neck's causing the headaches, or you know that before the headache or during the headache your neck hurts, that's a sign that the neck is the cause of the headaches, and that is even migraine headaches. If you get migraine headaches and your neck hurts before the migraine headache or during the migraine headache, there's a very good chance if you get prolotherapy in your neck, it's going to resolve the migraine headaches, or at least make it a lot harder for you to get a migraine headache. So cervicogenic vertigo, cervicogenic tinnitus, so ringing of the ears, vertigo, we often can get rid of it with prolotherapy, especially prolotherapy in the upper cervical region. Now, another common condition that people get diagnosed with is called myofascial pain syndrome. So myofascial pain syndrome is when there's muscle tightness in an area, and the underlying cause of that is injury to the ligaments beneath the area. So what you need is prolotherapy to resolve the cervical instability, and then the muscles will relax. So anyone who has muscle tightness in the neck, I definitely would recommend they get prolotherapy. And if you have any questions about this or any other video, please email me at drhauser@caringmedical.com.